Hi, Sabrina. Welcome.
Hop, allez-y. Là, c'est ma ligne. Voilà. Alors, est-ce que c'est possible d'enlever le truc de l'heure là? Parce que sinon. Non, voulez-vous mettre là pour le faire? Non. Hi. Can you hear me, Antonio?
Yes, I can. Loud and clear. Welcome.
I hope the image is not too bad because.
That's all right. It's perfect.
So you can how can
change
I
the slides. Yes, that's all right. No problem.
Okay. So I'm gonna say next. Okay.
Okay, and Gabriele will connect from a different place, isn't it?
Yes.
Okay.
So the slide presentation is divided in 3 parts. The first part I'm doing, then there is in the middle there is Gabriele, and then next the last part I will finish. You see the same slide as the first one with a slightly different title.
Okay.
And it will mean that we have to change the speaker.
Okay.
Okay.
I'll change for. I'll wait for your instructions when I won't try to. I will try to have some kind of indication from your side that.
Yes, of course, okay. But it's just I don't know if you can allow 2 speakers, or if you yes. Have to switch the speaker every time.
No. You're both allowed to speak. Yes.
Okay. So it will not be a problem because Gabriele usually know.
Yeah.
I hope his connection will be good because sometimes it's not. So anyway.
We'll see. In principle, usually Zoom is the best platform for this, in my experience. GoToMeeting is not bad, but Zoom is usually the most, the one I trust the most.
I'm gonna put a timer. And then for the question, how it works.
So during the webinar, people cannot speak, but they can write on a Q&A tool. If you look at the menu, there's a Q&A tool, and
Where is
there
the Q&A tool?
and
Yeah,
it's side by side with participants.
Okay.
And they write the questions there. And at the end of the webinar, I'm going to unmute everybody. So I will invite people to voice the questions, but in case they are not present anymore or not able to speak, I will read the question. And that's usually easy, basically.
And you will introduce us, or we're gonna introduce ourselves?
Yes, I will do a short introduction if you agree.
Yes.
I usually send some information before, but in this case I didn't. I will base myself more or less on what was on the site. Okay. Shorter, a bit shorter, quand même.
Vous vouliez mettre quelque chose derrière vous pour qu'on voit par la fenêtre ou pas? On se fait rien. Vous pouvez mettre un fond. Non, c'est pas grave.
Non, c'est bon. Il n'y a pas le fond sur le Zoom.
Sinon, j'en ai un sur mon téléphone si je veux. Si tout est possible.
Non, c'est bon.
Mettre une photo de vous à la plage. Non, on peut partager des photos qu'on veut. Je suis connectée avec votre compte.
So now I have 3 Sabrinas, but no Gabriele.
Yeah, I know, because there are people from my lab that are connecting to the presentation.
Yes. Yeah.
For the
That's
presentation.
not a problem.
So I don't know, Gabriele, what is doing. Maybe Linda, can you check with Gabriele? I'm gonna send him a message.
Okay.
On est en train d'enregistrer le truc. Hein.
Ah. Neither you can listen me. Gabriele, I don't know why. He said that he cannot, he has a problem in connecting. You see in the chat?
No, I don't see the chat, sorry, but I'm going to see.
If you look at the chat,
yes.
Gabriele is,
I can't speak.
I'm here, but I can speak. Neither you can listen me.
We don't have his image as well, and but I'm going to see. It's because he connected from a different email from the one that I sent it. So, okay, Gabriele, you can speak now.
Hello.
Hello.
Okay.
Oh, nice.
So that's better. You can speak and you can turn on your video. And
Okay.
Okay. And then, Antonio, can you go back to the first slide?
yes, I can. Sorry, it's because I'm clicking on my computer and it's passing the slides without.
Okay.
It's not what I want, but it's what it's happening.
Okay.
All right. Promote to panelist. Okay, now you can connect your video, Gabriele, because previously I think you couldn't. That is because you connected with an email that is not the email that I used to invite you.
Maybe because I joined with a message from Teresina. I don't know if
Okay,
this
no
is
worries.
the right one.
Okay, so even if we don't see you, we can still hear you. And we are going now to start, okay? So welcome everybody to this webinar on telemedicine in neuromuscular disorders, state of the art.
No, c'è ancora là.
Today, this webinar will be delivered by Professors Sabrina Sacconi from the Centre Hospitalier Universitaire de Nice and Professor Gabriele Siciliano from the University Hospital of Pisa. They are both neurologists and they have a very marked interest in genetic disorders and also in neuromuscular disorders. Most of them, or many of them, are genetic, as you know. And since Professor Sacconi works in Nice and is the head of the Department of Peripheral Nervous System and Muscle, and the coordinator of a basic research team at IRCAN, Institute of Research on Cancer and Aging, and working on the supplying of several databases and biobank on rare neuromuscular disorders. She's interested in particular in new therapeutic strategies for neuromuscular diseases based on the understanding of genetics, epigenetics, endocrine and immune system deregulation in the progression of these diseases. Professor Siciliano is full professor of neurology in the Department of Clinical and Experimental Medicine, University of Pisa, is the president of the Italian Association of Myology since 2015. He's got also very large interests in neuroscience and clinical neurology, where he works in the University and the Hospital of Pisa, and the main interests are around clinical, laboratory, and molecular aspects of neurodegenerative and neurogenetic disorders, acquired and genetic diseases of peripheral nerve system and skeletal muscle. He has many and fruitful collaborations with lots of international centers, and that reflects on his large publication numbers. And he works also for projects that are funded by institutional and charity bodies with responsibility in research evaluation committees for public and private funding. He, last but not least, he's been the coordinator of the nationwide Italian collaborative network established in 2009 under a grant by Teleton, and that has already developed a web-based registry of patients with mitochondrial disorders. So I think that reads very well for the kind of webinar that we are going to have today. Thank you to both, and the floor is yours. Please.
Thank you very much, Antonio. So good afternoon to everybody. Today we're gonna talk about telemedicine in neuromuscular disease, and to try to have a state of the art of these practices that has expanded a lot since the pandemic situation exploded. The next slide. The outline of this presentation include a little bit of background, the use of telemedicine in the context of COVID-19 pandemics, the new challenges, the implementation of remote assessment, and then some practical example of projects with at the European level, and the conclusion. Thank you. Next slide. So first of all, telemedicine, it's something that it's really not new, because it's more than 10 years that is used in clinical application as a way to connect with patient and provide them with specialized clinical care by the means of an electronic platform with the aim of improve patient self-management, in particular for patients that have limited access to health services. So there are several types of telemedicine, include teleconsultation, in which you have a patient and a doctor; tele-expertise, in which you have two physicians, two doctors that exchange their expertise. Then you can have medical telemonitoring, in which you have a patient that is monitored on the long term, and then you may have teleassistance and medical response. Next slide. The reason that lead to the development of telemedicine was the fact that the population is increasing, as well the need of medical support. The population is also aging. 60% of the patients with neuromuscular disease have more than 65 years of age, and 30% more than 70. So this aging of the population introduced the fact that these patients have a lot of comorbidity, and they have a very rare disease. They can be geographically isolated, and there is a decrease in supply of human resources and limited clinical intervention due to the fact that the expertise in neuromuscular disease is very long to achieve. And in these diseases, we see that the earlier is the diagnosis, the better is the care that you can provide to your patient. And this patient needs a constant follow-up. And now we are facing an era in which new therapeutic are coming, and which increase the need of having very detailed clinical history and real-time study. And also, we want to improve the global health status of our patient with, for example, by providing them of coaching program and to prevent the loss of their autonomy. Next. As we know, the neuromuscular diseases are very heterogeneous. It can be genetic or autoimmune, and include a large spectrum of diseases, in which most of them display great disability. They may have also multi-system involvement, including cardiac, respiratory impairment, but also multi-organ impairment. Next. This is just to summarize that there is a real difference in diagnosis of neuromuscular disease. If you look at the delay in diagnosis, it's much higher in non-neurological specialists compared to people that are specialized in neuromuscular disease, and this can this delay can be critical when we want to introduce new therapy, because we want to be as early as possible introducing this therapy. We need to improve the access to expert center for neuromuscular disease, and which is one of the aim of the ERN in neuromuscular disease. And as you can see, there is a different distribution in Europe of healthcare center, with some countries in which there are a lot of center experts in neuromuscular disease, and other countries in which the access of expert center is limited. Next. Next. So the telemedicine developed in this context next. There are several examples of telemedicine approaches in neuromuscular disease that have been developed before the pandemic, and all these examples conclude for an improvement in the quality of life of the patient with a reduced hospitalization rate, and also in improvement in quality of life of the caregiver. Next. There are also some criticism about this type of approach, because, for example, for us, when we have to evaluate a patient, a neuromuscular disease patient, we need to, for example, evaluate muscle force, sensitivity, reflexes, and it's very difficult, and it's impossible to do it remotely. So we have to think our neurological examination differently. Next. In the context of the COVID-19 pandemic, the telemedicine spread all over the Europe because we want to avoid our patient to come to the hospital, and these patients are higher risk of complication, and we want to try to keep them at home, to keep them safe, and to keep safe also the caregiver, and we want to provide to them the same level of care, even if it was quite difficult to organize the care of this patient in terms of paramedical support, like, for example, physiotherapy and other support that they are not taking into account in telemedicine. Next. So there are different rules that has been used in different countries to protect patient from contamination and to organize this care. These rules are not homogeneous at all, and different countries adopt different systems to limit the contamination in this extremely fragile patient. Next. Most of the country use telemedicine for this to take care of this patient and to enhance care in several types of diseases, in particular the one that show higher severity, like ELS. Next. So telemedicine was not only developed for clinical care, but also we have a lot of development to maintain research in these diseases, which is an important point because we need to develop new therapy for this patient, and also to for teaching aspect, because all our students that learn how to do neuromuscular disease examination need to be taught, and also the patient cannot come to the hospital sometimes, and we need to find a way to examine patient at home. Next. So in terms of clinical care, the challenges are how to monitor muscle, how to monitor also respiratory function, gait, fall, speech or swallowing problem, how to improve the care while minimizing patient burden. And so in the first pandemic development of telemedicine, we don't have any specific tool to assess neuromuscular disease, to improve, to do diagnosis at distance, and we have a very few self-administered questionnaire developed in a digital way, and also the score of quality of life were not developed in digital way. Next. So now this is very clear that this part, the remote assessment, represents something that is very interesting, not only because of the situation, the actual situation, but also in the future to increase the number of possible visits during clinical research trial, and to monitor closely our patient and to have data in real life. There is a lot of measures that you can do more to understand the evolution of the disease, like for example, the one that is illustrated in this paper that has been developed from people from Hans-Luc Müller from Newcastle University that measure habitual physical activity in neuromuscular disorder. And it was very interesting to see that how was done digitally. Next. For the training and teaching is very difficult because we develop this system and the platform are still in development to do the teaching or the congresses, and the problem is the fact that this tool in the future, if the pandemic go away, can be also used to enlarge the population of students that we have access when we have a specific expertise, and also to reduce the number of transport by using telemedicine platform. Next. The problem that we have to deal if we want to organize better telemedicine is how to manage the data that come out from telemedicine, and also how to manage the patient journey through telemedicine, the integration of patient appointment into the hospital schedule, the management of electronic data transfer and electronic medical file, and also the electronic patient consent, and the protection of health personal data. It's very important for the patient. Is also a challenge to achieve the fact that not all the patients are instructed to use the tools that are necessary to connect in telemedicine, and not all the patients live in an area in which the internet connection allow to to perform the telemedicine. So we have to deal with all this problem while developing this type of approach. Next. The remote assessment is something that is becoming more and more important in the context of telemedicine to deal with all these challenges. And Gabriele will tell us something about all the project that has been developed in Pisa University in terms of remote assessment.
Thank you, Sabrina. Can you hear me?
Perfect.
Yes.
Okay, next slide, please, just to remind some concepts that Sabrina has underlined very well. In other terms, we are dealing with a general issue that is coming more and more relevant, not also in rare diseases, but generally in all the world of the disability, in which we have to think with the different categories, and I can see different dimensions by which to afford the problems of the related to the disability. This is, you can see here, a very nice analysis conducted some years ago on some needs and relevant issues in the dealing with the disability related to neuromuscular disorders. And we can see here a number of items that are not only just clinical, just medical, just neurological or other categories of professional medical activities, but especially related also to some everyday life items that are important to consider and to try to solve in the daily life of the patient. Next slide, please. And related to that, coming from the same document, we can see here how some dimensions are directed with what the progress in terms of utilizing also some non-conventional types of analysis of problems. And we can speak here about, for instance, bioinformatics or bioengineering. And in this sense, we have to start to consider also some more biotechnological considerations in terms, in particular, of telemedicine and related to that, devices for mobility assistance. Next slide, please. And we can see here how there are a lot of items and systems that have been developed in the last years, more or less based on advancement of biotechnology, which at the same time can record, detect a number of signals, and they can transmit them to a central recording area. But on the other hand, we have also, next slide, please, systems that are able to control, to modulate a number different activities made by the patient, and in particular the motor profile, one of the aspects that we absolutely need to evaluate in a patient with a neuromuscular disorder. Next slide, please. Here, very quickly, two projects that we are developing at Pisa in collaboration with other groups of scientists which are interested on that. One of these is called Desire, which is a system by which we want to decode and in with different strategy to reconstruct a language production from a patient who is affected by a dysarthric condition. So with this system, and we, by using an already known automatic system recognition, we can start, see at the bottom of the left corner of this slide, we can start for the crude raw physical signal, and we can extract a number of features by which we can design an acoustic model and then reconstruct an artificial language, but a language that can be useful for the patient to improve his possibility to interact with other similars, and also to enrich this function by emotional items. Next slide, please. Here, the system, how it has been constructed, is a collaboration from different research units in Italy, and it is developed both with a smart home environment assistance and also with a clinical management of the patient condition. Next slide. Here, the raw data we can use to characterize the patient with a number of items related to the clinical condition, to the clinical outcome measures, as well as to treatment intervention. Next slide, please. And here we have some examples of patients we have recorded with a number of recordings, and the time we have used on the right corner of this slide to decode the signal to build up a product that can be utilized in everyday life of the patient. Next slide, please. So this is an ongoing project by which we want to improve this technique to use in a number of neuromuscular patients with speech disorders, and also to create a normal Italian, but also to be utilized for collaboration in Europe. Next slide, please. This is the other project we have worked on in the last years. We called the AIG Kit, is an app for a smartphone by which we wanted to record a number of clinical and instrumental variables to be detected in patients affected by Pompe disease. And in that case, the patient association, the Associazione Italiana Glicogenosi, has collaborated on that. Next slide, please. Very basically, the characteristics of this instrument and by which we developed it with a collaboration among pathologists, psychologists, and bioengineering. Next slide, please. These are the areas in which the instrument can work on. These include the clinical aspects, more detailed motor performances. We have also a section by which we can interact with the patients, exchanging some news on this condition, and also a section in which the patient can, with a more emotionally component of his evaluation, can report his condition. Next slide, please. Here we have some examples on how the patient can feel the different fields on this very smart system to interact by telemedicine with the medical doctor, the neurologist. Next slide, please. And here again, at the bottom of the slide, some, apologize, is reported in Italian language, some conditions and some experience the patient can report, and by which we collected the cases followed in different Italian centers involved in the follow-up of Pompei's patients over our country. Next slide. And this is a very clear graphical modality to show you how we can follow over the time modifications of some parameters in the progression of the response to treatments of the disease. Next slide. One problem we have experienced for these initiatives has been related to some ethical and I can say procedural steps by which we had to afford the ethical committee approval to activate this a platform, a web platform in which to put all this data collected from the patients. And overall, we had some problems in our centers to overcome, next slide, please, some issues related to the privacy impact evaluation document. I think this has to be a very important point to be addressed in the next future to be able to improve, to let us to progress with these initiatives. In other terms, to make more easy to exchange this collection of data and to enable to build up a really functional and a really shared instrumentation that can be used by different centers between our ERN HCPs. Next slide, please. And this just to show you which are the problematic issues related to the PIA. You can see a lot of items that we have to take into account and to consider before to go ahead in this enterprise from just the considerations of the rules that we need to consider for that. Next slide. And with this, I go back to Sabrina, please.
Thank you, Gabriele. So we go back a little bit on telemedicine. Next slide. So this is an overview of the use of mobile health application and in Europe. As you can see, there is a lot of application that has been developed in United Kingdom and then in Germany, and then you see a little bit the other number of application. And this is a study that it's worldwide, that has been conducted several years ago. And as you can see, the lead domain in which the application has been developed is a mental health application. So in the future, the market study present a strong development of application, mobile health application in the domain of neuromuscular disease, because there is upcoming therapy and there is a need to follow up the patient in a more close and patient empowering way. Next slide. To assess the interest of telemedicine and also of medical devices connected to telemedicine as application or other medical devices, there is set up by the European Commission of recommendation. It's a multidimensional evaluation framework that is proposed if you want to evaluate your practice of telemedicine, and this model is called MAST. And there is in this model a multidisciplinary perspective in order to see if the way that you are applying telemedicine to the care of your patient is relevant, and if the patient that you are treating are satisfied and you are also satisfied on your own job. Next. It's very important to evaluate your practice and to try to understand the frame in which you want to develop telemedicine beside the specific context of the COVID-19 pandemic, and what are the patients that you can follow by telemedicine, and in which patient the use of telemedicine can represent a lack of chance in terms of care or treatment. Another problem that you have to cover is the fact that the coverage by health insurance of telemedicine can be insufficient. This is the example of France, in which you will receive for a telemedicine act between 23 to 58 euro. Depend on the specialty of the doctor. So we demonstrate in the study that I'm going to present you that this amount of money is really insufficient because the use of telemedicine, especially when you have to deal with the multidisciplinary approach that we are used to give to our patient, takes a larger effort. And we need to have a stronger organization, especially if we want to take care of patients that live in very in island or in very in the countryside, in which there is no connection and the people are not used to this type of tools. At least in France, we are now trying to work in projects in which we use the MAST evaluation in order to demonstrate that we need to develop some specific packages to take care of patients with chronic neuromuscular disease. Next. So we are now involved in two projects. One is a national project in which we connect the center of Nice and of Marseille to two centers in Corse Island. This project has been done with the sustain of the regional association of health association of Corse and the IFM Teleton. And the second project that I want to briefly talk about, it's a European project called Alcotra Prosol. Prosol is for proximity and solidarity, in which we develop telemedicine in cross-border territory between France and Italy. And this project was funded by the Europe and sustained by the locally for the part that concerned France by the Metropolis Côte d'Azur. Next. So basically, it's the same object. Is try to understand if it's interesting and of the use of telemedicine in these territories. What are the challenges that you have to deal with, and the time that you have to use to develop this type of approach. And also how to ensure a long-term existence of telemedicine in hospital in which you don't have any people that is trained to take care of this type of patient, and you have very limited resource in terms of human being. Next. There are several aspect of these two projects. That one is the telemedicine, so it's the clinical part. In the European project ProSol, we also not only we deal with the neuromuscular disease, but also we have developed telemedicine for neurodegenerative and neurodevelopmental diseases. So it's a large population from children to aged person. And the idea is to evaluate this project in order to develop adapted packages. And these packages will cover the time that you spend in the organization, the cost of the training for the people in the hospital of proximity, but also for the people that can go to, at home and help us with the clinical examination. And also how to develop the clinical research at home and education and training using telemedicine. So we are using a specific solution that allows us to reach this patient, and we have next the preliminary result of the studies show a very good feedback from physician and patient after using telemedicine, and we have seen that it demands a huge organization, because especially when the patient have to go to the proximity hospital, because of the limited resources, human resources in this hospital, and the fact that these resources are not trained specifically. So they are a little bit scared to deal with this patient, especially if they are severe. So we need to improve this part. And also there is, for the patient at home, there is a need to educate this patient of the use to new technology. We have the good news was that we have a very few technical issues, even if the internet connection was a little bit bad. We could perform all of the teleconsultation, even the one that involved multidisciplinary team that lasts several hours, and we could train and teach the professional using e-learning at distance, and also we are starting now some clinical research study involving medical devices, and it seems that this system is also adapted to this type of approach. Next. So in this slide, I try to put together all the pros and cons of using telemedicine with a specific eyes on neuromuscular disease. I think the most important aspect we have to develop, besides the use of medical devices that can be represent a cost and also a problem, because it can be a technical problem to use this type of devices, is the fact that we have to try to approach the patient differently and to try to develop a different type of physical examination of neuromuscular disease patient. There are also another important point is the fact that patients lack of paramedical support like physiotherapy, psychological support, and nutritional support, and all these acts are not refunded by the health insurance systems, and we need to try to understand how we can provide this patient with this type of support. The other problem, the last problem, is the emergency situation. So it's very difficult to schedule telemedicine, and also, and particularly, it's very difficult when you have to answer an emergency of this patient. So we have to try to understand how to deal with this point, because for the sake of our patient, maybe to extend the use of telemedicine to other specialists that can be more reactive than an expert in neuromuscular disease. Next. So the idea is to try to understand through a survey between all of you what are the advantages and the limitation of telemedicine based on the approach that you had during the pandemic. We're going to send you a survey that we are developing among the muscle panel and the educational panel of ERN in order to try to understand the European landscape and to try to point out what are really the pros and cons of this approach that you experience in your real life. We know that we can increase the quality of life of our neuromuscular disease patient. We cannot completely replace classical consultation, but we can improve our way to provide care and follow-up of our patient. So we need your input to try to understand better, and we need to set up probably a common organization in order to improve the care of the patient at distance. Next. So I would like to thank all this entity for that have supported all the work that are presented in this presentation. And I would like also to thank Antonio for the organization, and I leave Gabriele the first word.
The last word.
The last word.
The last word, the next slide, please, Antonio, is just to remind you that for this I'm proud, happy to share, first of all, with Sabrina, who organized the first Congress on the topic in 2019, but also you can see from the steering committee of this small scientific group that we are going to build up and hope to realize in the next future. And just linked to that, an advertisement for the next event we called ENMD. E is like electronic, but just a form of enrichment of our more clinical activity, and by which we want to follow and propose all the possible future development of the e-health and the innovation related to these diseases, with the final aim to overcome barriers. And if we think to the basic phrase of our ERN, building bridges and breaking barriers, we deeply think that telemedicine can be one of the main pillars for this, I can say, quite new dimension of our competence. So we hope to organize in vivo, in presence, this next event. You can remember that last year we had to organize that virtually. But next slide, Antonio, the last one.
Yes.
We hope to have you in this, maybe at the end of the year, but we will give you details on that. Thank you, Antonio.
Thank you. That was a wonderful presentation, and I think that very interesting and rich. We have several questions already, and the first one comes from a very known person, Dr. Conrado Angelini. Dr. Angelini, if you want, you can unmute yourself and put the question directly. Otherwise, I will read it.
Okay, Antonio, can you hear me?
Yes, you can. Yes, we can.
Okay, I congratulate Sabrina Sacconi and Gabriele Siciliano for this entertaining and very interesting seminar. And I was particularly puzzled by this project that is developing in Pisa by the name of Desire, and is directed, I understand, toward speech. I would like to have Gabriele Siciliano comment both on speech and on prescribing exercise in ALS patients. Do you think this could be done by telemedicine? Has this been done? I know there is telemedicine in Turin for following the status of the patient, but what about for prescribing exercise or taking care of these arthritic patients?
Thank you, Corrado, for this very stimulating question. On the other side, we could expect that if we consider that you are one of the members of the scientific committee of the ENMD. And we all know that this is one of the masterpiece problems in neuromuscular disorders, to try to understand at which extent it could be useful or alternatively could be dangerous for patients in the different motor performances, including the speech. This is a quite new field, and we have to think about on what we can learn by these experiences, and particularly from the project we are building up. But I think that if we consider that we can use these new generations of biosensors, and also we can use algorithms to find the best profile of an exercise performance that can be evaluated and can be monitored with respects to, for instance, the indexes of fatigue, of the indexes of exhaustion, and all those biomarkers. We can say better, those bioengineering markers. I think that we can have a tool by which we can answer to all these questions. So what I want to say is that we have to change a little bit our way to think about these more clinical problems, and maybe we can get advantage from using these new techniques for answering to those more classical questions.
Okay, so there's a question from Neringa Mustekait. You can unmute yourself and put the question live, please, or otherwise I'll read it. Okay, in that case, the question is if you know or if you can share any experience of telemedicine in the pathology field.
In pathology, anatomopathology field, it will be more a tele-expertise than a telemedicine, in which there are two people that are discussing within each other. I think that Euro-NMD provide a way to discuss around a pathology images, and I think that you may have some information. Antonio will provide you with some information about this system in which you can discuss clinical cases and also histological images with experts in this field.
Yeah, I can confirm that so-called CPMS, so the Clinical Patient Management System, as a core group of experts in neuropathology, and they can be contacted to discuss cases, and they are starting to organize regular case discussions on the side of the demands for tele-expertise to basically incentivize the exchange of expertise and information between those experts. So the next question is from another known name, Dr. Peter van den Berg. You can unmute yourself, please, and put your question.
Hello. It was an excellent presentation. I don't know whether you hear me.
Yes, we do.
Okay. So congratulations. It was very interesting, and I enjoyed it a lot. I think your experience with telemedicine is just great, and I think it may serve as a very good example for what we need in the European reference network. And of course, in our case, it's Euro-NMD, because Europe should indeed know how this works in several countries already, and they could learn from this on how to improve things. And an important aspect, I think, is indeed financial compensation for the work we would do with the CPMS. So that's the comment I wanted to make.
Yeah, quite agree. I think that currently the Commission is also already aware that the different ERNs want the CPMS on one side to be integrated into the national healthcare platforms, and that basically the work that the experts develop inside the CPMS and around all the support that it implicates should be and needs to be recognized as working time for the experts, of course. It's almost laughable to say it, but unfortunately it was set up without those type of preoccupation already cleared. So we are now asking for basically the different healthcare systems to recognize that when an expert is working on CPMS, he's working. It's not video games, basically.
May I add?
Yes, you may.
No, I think that obviously we now face a very new, innovative area in which we cannot be at the moment quite precise in the different aspects and so on. But I think that when we talk about telemedicine, we have to maintain a basic fundamental element that telemedicine is, from my point of view, is or should be mainly based on a communication between the patient and the clinician. And this is the basic axis along which we have to, we can build up a number of further developments of this area. So no, we talked before about how telemedicine can be useful for pathology. Yes, it can be useful, but this is a discussion between experts. Mm-hmm. Another thing is to consider the connection between the patient and the clinician that, my point of view, remains the basic aspects of telemedicine. And related to that, I think it should be useful also to know the point of view of the patients and what do they expect from that, what are their thinking, and then their way to afford this area.
Okay. I don't have any further questions. I would just like to thank Professor Sacconi and Professor Siciliano for this fantastic presentation and for the discussions that it may trigger. So one thing that is good is that beside all the people that were today in live watching it, we will make it available through the Euro-NMD website, and it will be also available on the Euro-NMD YouTube channel in a few days. Okay, so that can be revisited, and you can afterwards indicate that as well to junior people or students that may have the interest of getting acquainted with the team. And so thank you very much to both, and hope to see you all very soon. Bye now.
Thank you very much, Antonio.
Bye bye.
Thank you. Bye bye.
Bye bye.
Bye-bye.